Okay, I think we'll go ahead and get started. I apologize if some people are having difficulty. Everyone should be unmuted. This webinar will be recorded, so we can distribute it for further use. So again, thank you. Skriptash, we're very appreciative to be able to talk a little bit about COVID-19 vaccinations here on the nation, and want this opportunity to be able to ask questions and share our input to your questions as much as possible. Today, it will be myself, Dr. Rodrigo Villar. I'm a pediatrician, also work in public health here on the nation, and Dr. Elizabeth Van Dyne. And Dr. Van Dyne, you could introduce yourself.
Hi, good afternoon. This is Dr. Van Dyne. Thank you so much for the opportunity to be here today and to discuss the COVID vaccine. And I as well am a pediatrician and work in public health. So thank you so much. And with that, I'll let Dr. VR begin with the slide presentation.
Thanks again so much. So COVID-19, the pandemic has really had a lot of devastating impact on all of us in our personal lives, for our family, our work, school, and regular lifestyles. What we wanted to show here is how, in numbers, how much it's impacted. As of yesterday, across the world, there have been 141 million cases identified with COVID-19 and over 3 million deaths. In the United States, we've had over 31 million cases with over 500,000 deaths to date, and this continues. In Arizona, we've had 854,453 cases identified, 59,000 hospitalizations, which represents approximately 7% of all cases end up in the hospital, and over 17,000 deaths, which is about 2% of all cases. Closer to home in Pima County, we've had 114,294 cases. So those are people that we know and work with. Among those, 7,026 people have ended up in the hospital, so that's 2% of the local case. 6% of the local cases, and 2,381 persons have expired. Again, about 2% of persons in Pima County. And more importantly, here on the nation, we've had 1,763 cases recorded, 237 hospitalizations, so 13%, 13 out of every 100 people end up in the hospital, and 76 persons who are community members. 70 are registered Tohono Nation members, and 6 persons of other nations who live in the community have died, and that's 4% of all of our cases. So it's really impacted everyone here to a tremendous amount so far. What we've all tried to respond with nationally, internationally, and here at home are mitigation and prevention strategies. What mitigation and prevention aims to do is reduce the severity of disease. So rather than being hospitalized or death, that we can minimize how severe it and how impacting this pandemic is, and also prevent disease. So that's where vaccination comes in. That's where our separation, distancing measures come in. So what have we been doing here on the nation? We've asked people to wear masks. We have mask mandates. And the more that we can wear masks, the less we'll transmit disease to others, and also we'll protect ourselves. We also emphasize trying to maintain a 6-foot distance. We know that in most cases, when people talk, cough, most of the droplets that have virus will be on the ground and not infect people if you're about 6 feet away. We ask people to wash their hands a lot, because we know that a lot of germs stay on our hands, and the more frequently we wash our hands, the less we'll transmit to others and also to ourselves. We ask people to also avoid crowds and gatherings, because the more crowded and the more people are together in one location, especially in small indoor spaces, the higher chance that you can get infected. And the other big prevention strategy is vaccination. And we're very fortunate to now have several vaccines that are very effective in preventing COVID-19. So why is COVID-19 vaccination so important for the Tohono Nation? Well, historically, pandemics have really devastated American Indian and Alaska Native communities. We know that in the past, smallpox, measles, and flu were huge, devastating diseases that could rip through communities and wipe out sometimes 90% of small communities. And with that, not only people are dying, but their communities' culture, their communities' language and tradition also gets wiped out. Just for an example, in the 2009 H1N1 flu, the death rate or mortality was 4 times higher among Native populations than in the general population. So we know that historically pandemics have hit Native communities very hard. A report from the CDC looking at the impact of COVID-19 between January and June of 2020 showed that among American Indians and Alaska Natives, COVID-19 was 3 times more likely to be diagnosed than in non-Hispanic whites. So if you're Native American, you're at much higher risk for contracting COVID-19 disease. And the mortality rate, or persons who died, was almost twice as high. And specifically, mortality rates compared to white people for certain age groups are hugely higher. So in young people, ages 20 to 29, the death rate was 10.5 times higher. In young adults 30 to 39, the death rate was 11.6 times higher. And in the age group 40 to 49 years, 8.2 times higher. So it's a big impact. And we emphasize that in young people because a lot of young people feel that they're not going to get sick and that COVID-19 is not going to affect them. But it really does in Native American communities. Why, again, is vaccination so important for the Tohono Nation? We know that many of our community members are already suffering from underlying health conditions. When we looked at how many people had underlying medical conditions among community members with COVID-19, about 73% or almost 3/4 of our population had some type of underlying medical condition. The most frequent of those were obesity at 61%, diabetes at 30%, high blood pressure, hypertension at 28%, lung diseases like asthma or chronic lung issues at 16%, kidney disease at 8%, heart disease at 5%, persons with weakened or immunocompromised conditions 3%, and pregnancy 1%. And the reason we bring up those health conditions is because those are tied and or associated to more severe disease outcome with COVID-19. So we already know that we have a community that is at higher risk, and many people in our community have high-risk conditions that put them at risk for more severe disease. What we want to do is preserve the O'odham, Apadag, and Himdag wellness and culture. So during the last year, as vaccinations were made available, first in December of 2020, and up till now, we have rolled out 13,700 doses among our community members, persons of other American Indian tribes who come to us, our employees, persons who work or associated with the nation. So a lot of thanks to all the people that have worked hard to be able to administer vaccinations both locally in our health centers at San Javier, San Simon, Cells, as well as our community clinics in several of the villages. A lot of work goes into that, so thank you for everyone who's participated. And our goals are really to vaccinate 80 to 90% of the eligible community. It's thought with many vaccines that if you can vaccinate 80 to 90% of any given community, you achieve what's called herd community or community immunity, community protection. And it takes that many people to be protected so that you don't continue to propagate or spread disease. And with COVID particularly, scientists think that 80 to 90% is what we need. I also say eligible community because we know that children can get and spread COVID, but at this time the vaccines aren't authorized for young children. So eventually, as those authorizations come through, hopefully we'll be able to add them to that list. We also want to prevent the severe cases, so prevent hospitalizations and death from COVID. Hopefully it just becomes a mild cold or no symptoms at all through vaccination. And ultimately, really, we want to preserve life, the functioning of society, promote culture and wellness. There have been some studies that across the United States, it's estimated that every 1 of 400 to 500 Native Americans has died from COVID. And with them, they take culture, they take language, they take tradition, and we want to help preserve that. So we'd like to talk about some myths and facts about COVID-19 vaccines. I think for most of us, we want to understand that the vaccines have safety involved with their production and delivery. We want to know how the vaccines work. We want to know that if the vaccine can give you COVID-19, what they might contain and don't contain. We are all concerned about potential side effects. There are some groups that have increased concerns, particularly, for instance, women who are pregnant, women who are breastfeeding a baby. And also we want to know what are the pros and cons compared to protection if someone gets COVID-19 naturally and has some protection. So let's talk about some of those. So one of the vaccine myths is that the vaccine was rushed and isn't safe. A fact about the vaccines is that researchers took no safety shortcuts. These type of vaccines have been studied for many years, and with COVID-19, a tremendous amount of funding was put in, and the same safety and rigor looking at how the vaccines worked and if they would be effective were put into them. Additionally, they were studied in very large groups of people. These are tens of thousands, in some cases 70, 80,000 participants in the studies to check to make sure that they were safe and effective. Another vaccine myth is that it will change your DNA. Well, some of the vaccines are called mRNA vaccines, and it's clear that you could get it confused with DNA. mRNA is a way to provide a message to your body's immune system so that it can set up protection, but it doesn't affect your body's blueprint or the DNA. Those are in different parts of our cells, and the mRNA never enters the nucleus or the center part of the cell where your DNA is, so it doesn't alter your DNA. And that's a good question, and some people have had a lot of concerns about that. Can the vaccine give me COVID-19? Another good question, because some vaccines in the past, for one example is measles, one example is polio. Those were vaccines that were made with weak viruses, and as long as they're safe, you can use them. In this particular case, the current vaccines that are authorized are not live or weakened viruses. They are messages to help teach your immune system how to make protection. Some people have egg allergy, and in the past they were afraid of egg allergy with some of the vaccines. So the COVID vaccines, the current ones that are available, don't contain any egg products, so people don't have allergies from that. They also don't contain a lot of other products that people are concerned about. So there aren't any preservatives. There aren't any antibiotics in these particular vaccines. So it does make the job of safely storing and administering the vaccines, we have to be very careful with them because they don't have preservatives or other products. But for people afraid of certain allergies or worry about different chemicals, they don't contain those. Another vaccine myth is that it causes severe side effects. Well, for most vaccines, you can get some mild side effects, and with these vaccines as well. These are mostly headache, low-grade fever, body aches. The vast majority of these go away in 1 to 2 days, and most are completely gone in 7 days for most people. So it doesn't so far have any severe side effect, but those are looked for, and we'll talk a little bit more about those. The vaccine could make women infertile. Well, with these particular vaccines, there's no evidence that the vaccine causes infertility or problems having babies. These vaccines specifically were not studied in pregnant women. However, other vaccines that are made from mRNA have been studied in pregnant women in diseases like Ebola and Zika virus, and they've not been shown to show any problems with fertility or causing problems to the baby or birth defects. And some people think, well, you know what, I have a healthy immune system and I'd rather catch COVID to gain natural immunity. Well, that potentially could be a good idea, but we know that this pandemic has caused a lot of problems with a lot of people. We know that if you get natural immunity, it lasts shorter. The immunity does not protect you from spreading it to other people. And one of the big advantages of getting immunity through vaccines is that the vaccine allows you to build your immunity without getting sick yourself, without getting damaged, without getting hospitalized, the risk of death, and without having to spread disease to other people. So what we wanted to do was share a little bit about some frequent questions and answers about COVID-19 vaccines that the CDC has on their website, and they are generally surrounding safety. One way that the CDC and the Food and Drug Administration look at vaccine safety is through a program called the Vaccine Adverse Event Reporting System, and this system helped pick up what's currently in the news about the Janssen vaccine. So there were 6 reports of very severe but very rare occurrences of an unusual type of blood clot in the brains, in actually the veins that drain our brains, in 6 women. And this was among a number of approximately 6.8 million doses of Janssen. So they're still looking at it to see if it is associated with the vaccination, and the VAERS system helps pick up any risks that potentially could be associated with vaccines. So far, the vaccines that are available, the Moderna, Pfizer, are appearing to be very safe, and Janssen also is appearing to be very safe, but it's important to look at these and use that VAERS system to identify if an event is very rare, it could potentially be serious like these, but we want to be able to pick those up. The graphic I have on the side gives you an idea of how we can look at the risks versus the number of doses. So across the United States, almost half of the country has had at least 1 dose of a COVID-19 vaccine. So that's about 150 million vaccine doses have been delivered. And among these, 0.005% have resulted in any serious side effects. So that's that little dot that's shown down at the bottom to kind of put things in perspective, because it's often hard to relate when we talk about strict numbers. But that gives you an idea of how many people have been vaccinated, and luckily we do have a system that can help pick up if there are any serious side effects. We talked a little bit about pregnancy. We'll talk some more. But the vaccines so far have been shown to be safe and effective. So if a pregnant woman is interested in getting vaccinated, we can provide information. We also encourage them to seek direct counsel from their own doctor. But they appear to be safe and effective for the woman and for her unborn baby, and especially can provide also some protection to the baby once the baby is born through the mom's breast milk. Another question we'll talk about is, what do we do with our masks and our activities after vaccination? So we'll focus a little bit more on that as we answer some questions. So I'll switch over to Dr. Van Dyne, and we'll start some of the questions and answers that you have put forward to us. Thank you so much.
Thank you, Dr. Villar. So thank you to everyone who submitted questions. So we're going to go through our the questions that are specifically COVID-19 vaccine related. So we'll start with this first one. Dr. Villar, do vaccine shots 1 and 2 trigger joint pain?
So again, most people are very concerned about what kind of side effect they might have. COVID vaccines have not been shown to particularly trigger any joint pain. However, the most common side effects that people describe after vaccination, about 1 in 5 to 2 in 5 people will describe headache, low-grade fever, muscle aches, and feeling tired after the vaccine. The vast majority, 80 to 90% of those, resolve in 1 to 2 days. And some people will also have pain at the site where the injection occurs, just like other vaccination, but it's not been associated with specifically joint pain. Dr. Van Dyne, I'll ask you this next question. Are the negative reports regarding pain to the arm after receiving vaccine shots preventing individuals from getting vaccinated?
So that's a good question. One of the things that I would say is really important is to talk to people about what to expect. And so if people understand that it is possible to have a little bit of arm pain after receiving the vaccine, people are more comfortable. So I will say, I think it's important to share our stories as well. And I did get the COVID-19 vaccine, and I did have a little bit of arm pain the next day, but then after that, it went away. So I think it's important for all of us to share our stories and experiences with getting the COVID-19 vaccine. And I think that helps a lot of people when making their decision. We'll go to the next question. This is question number 3. Has there been any cases of Awesome having serious bad reactions to the vaccine?
So as Dr. Van Dyne was saying, it's important to share our stories, and that's something that we really want people to do whenever they get a vaccine or any other medical device, medication, that type of thing. As healthcare providers, we want to know if there's a bad or adverse side effect. So far with the COVID-19 vaccinations, we have administered, as I mentioned, about 13,700. and we have accessed that VAERS system to look for any adverse reactions. The most common adverse reaction that we have seen have been the expected side effects. Some people get lightheaded whenever they get a shot, and so we record those even though they're expected side effects. Some people have anxiety. Again, we expect that. They have arm pain, and we record those and we put them into the VAERS system, because if someone comes to us and has a concern about an adverse effect, we want to collect those data so that we know in the big picture if it's affecting anyone. So far on the nation, we've only had one person that had to seek medical care, and it resolved without any problem and is doing well. But other than that, as I mentioned, most of them have been the expected side effects, and everyone has resolved well. Dr. Van Dyne, have there been any deaths that you know of or through these systems from the vaccine? If so, how many?
So for this question, as Dr. Villar said, we do our reporting to VAERS, and that's the Vaccine Adverse Event Reporting System. So locally, we haven't reported any deaths due to COVID-19 vaccination. The COVID-19 vaccines are safe and effective. And as Dr. Villar was talking about, in the United States, millions of people have already received the vaccine, and it undergoes intensive safety monitoring. So as far as in the United States, as far as detecting patterns and cause of death that would indicate a safety problem with the COVID-19 vaccine, CDC has not detected any patterns and cause of death that would indicate a safety problem. CDC also does a full review of available clinical information, including death certificates and medical records, and this has to date revealed no evidence that vaccines contributed to patients' death. So that's the current up-to-date information that the CDC has provided to us, and we'll keep you updated as we continue to follow the guidance. I would also say, as far as the vaccine goes, Dr. Villar talked about how with the Janssen vaccine there were some serious side effects, but those were incredibly rare. And as far as the Janssen vaccine currently, we are currently not using that vaccine in the ton of the nation. That vaccine is on pause and following FDA and CDC guidance. So the next question, please add, Dr. Villar.
Thanks, Dr. Van Dyne. I was going to add that that's the good thing about having these surveillance systems, because when they did the studies, as I mentioned, they had about 70,000 in each different vaccine study. But if an event is extremely rare and only occurs in 1 in every million doses, you're not going to find it in the initial studies. And so far, over 150 million doses have been administered across the United States. And that's really the only way you can identify if something's extremely rare. And now the next part that the CDC and the Food and Drug Administration are working on is to see if any of these rare events are actually associated with the vaccine. So as she mentioned, we will share that information as it comes to us. Thank you.
Dr. Villar, the next question is it safe to get vaccination if you are pregnant and if you are breastfeeding?
So that's another great question, and I think it's important for expecting moms to ask because they want to protect their baby. There are some vaccinations that are called live virus vaccinations that you are not supposed to get while you're pregnant, because it's a live virus. And if your body is exposed to a live virus, you can potentially infect the baby. These aren't live viruses. And so far, the studies that have been following pregnant women who have been vaccinated indicate that everything is safe. It's safe for the baby. And more importantly, when women have protection themselves, they can provide that protection to their baby before birth even, and then after birth through breastfeeding. So like with flu vaccine, if a woman gets vaccinated for flu, she will provide protection to the baby through her breast milk. The same thing appears to be with COVID vaccine. So if a woman is vaccinated during pregnancy, she'll be able to provide her baby protection through her breast milk. So at this time, women who are interested in getting vaccinated absolutely can get vaccinated. So let's talk about a little bit about how effective vaccines are. Dr. Van Dyne, how long does the vaccination last, and do people have to get the vaccine again in time?
So the vaccines are something that we're learning more about every day. So when the vaccines were started, they were started through clinical trials. And so people were vaccinated and then they were followed over time to see if they ever developed COVID-19. So we know based on the trials and what's been done to date that those vaccines last at least 6 months, and we do anticipate possibly up to 12 months. However, we don't know how long those vaccines will last. We do anticipate that we will have to get vaccines in the future, kind of the similar way to the flu vaccine. So we'll follow the CDC guidance and the FDA guidance as far as how far apart the vaccinations should be. And currently, we do know that the vaccines last at least 6 months from the date administered. The next question, Dr. Villar, is there any truth to people having to receive vaccine boosters as months go on after the first vaccine?
So you touched a little bit on that already, and with most vaccinations, we often do get boosters. There are very few vaccines that you only get one shot of. So if you can think of most of our childhood vaccine, your tetanus, you get a booster. As when we're babies, we get polio boosters, all sorts of boosters to help teach and remind our immune system. It sounds like most likely we'll be getting boosters. And the other piece about this is that we've heard about variants, and as the variants change, the vaccine might change. So we might get boosters that are more specific to variants and help protect us that way. The good thing is, as Dr. Van Dyne mentioned, it looks like our protection is at least 6 months to a year. But most importantly, that protection keeps people out of the hospital and keeps and prevents deaths. So even if we have lessened protection, it looks like it will be very effective in keeping us out of the hospital and from severe cases. Dr. Van Dyne, how long after you get the vaccine are you protected from the virus, or could you still get the virus?
That's a great question. So as far as how long after you get the vaccine are you protected from the virus, and can you still get the virus? It actually is possible to get COVID-19 after you get the vaccine. However, that is extremely rare. So we talk about the vaccination for Moderna, the one that we use here, as being 95% effective. However, what we do know is that it prevents hospitalization and it prevents death. And so the COVID-19 vaccine prevents severe disease, and that's the most important thing. So yes, it is possible to get COVID-19 after. The other thing to consider is there are, variants and strains that could come about in the future. And that's one of the reasons we talk about a booster as well, because there may need to be a booster for a different strain of the virus. So how long after you get the vaccine are you protected? So you're protected starting 2 weeks after your second dose for Moderna. We know that it will last at least 6 months, and we'll continue to provide updates on how far out that the vaccine lasts for. Dr. Villar, the next question is a little bit more about the variants. So we are hearing, this says about 3 variants of COVID. Which vaccine prevents the different variants?
So I think this question gets to the point of what is a variant. A variant is a subtype or a mutant of the original COVID-19 virus. As technologies have improved, we know we can now test for COVID, which we weren't able at the beginning of the pandemic. Now we can test for COVID, and specifically we can test what the genetic fingerprint of COVID is. So we can tell whether that COVID is from a certain geographic location, and there have been several that have originated in different countries. And as people travel, those variants can travel with them. And so that was one of the reasons that they had some travel restrictions. And when we asked people to isolate or quarantine or restrict their movements, is to prevent spread of COVID COVID-19 viruses and especially some of these variants. So the three more common variants that people have heard about in the news have made the news because one, they can either be more contagious, or two, they can cause more severe disease potentially, and three, which would be the most concerning, is that the vaccines wouldn't work or the medications that we have wouldn't work. So doctors are looking at that specifically, and most likely in the future, if we have boosters, they're going to be covering those new variants as they come out. Right now, thankfully, for most of the variants that have been seen in the United States, the vaccines remain effective. There is some concerns about one particular, the South African variant that is now in many countries. The vaccines are less effective against that. So that's why it's important that right now, the more people that get vaccinated, the less chance that COVID-19 spreads and has a chance to mutate into new and more severe or serious strains. So it's great to keep up all those preventive measures of wearing our masks, avoiding crowds, and now knowing that we can get vaccinated helps prevent the pandemic. Let's go to the next set of questions. Dr. Van Dyne, if I've been fully vaccinated, what are some of the things I can and cannot do? So this question asks specifically, how long do you need to be in quarantine after you get the vaccine before you go out in public?
There's a couple parts to this question. So the first one is how long till you're fully immunized. So with the Moderna vaccine, you get one dose, then you get the second dose 4 weeks later, and then 2 weeks after that, you're fully immunized. So again, before that, it still is possible to not build your immunity and to get COVID-19. The next part of it is, what are the activities that people who are fully vaccinated can do? So first of all, the most important thing is to follow the executive order and the ordinances set out by the Tontha Nation. So no matter what's stated by CDC or state orders or other things like that, most importantly, follow the local executive orders and guidance. So currently, recommendations are to continue to stay at home, to continue to wear your masks out in public, continue to physically distance, and to continue to not have large gatherings. So again, those are the guidance. So please, when you go out in public, please continue to wear your mask. That supports our frontline healthcare workers and other people like that. But as far as when you are immunized, that happens 2 weeks after your second dose of vaccination.
So the other part of that question, I think, is, Dr. Van Dyne, if you can expand on it. Before we had vaccine, if I got exposed to COVID, I would be told to stay in quarantine and watch. If I have had my vaccinations, do I need to stay in quarantine, or does that help me continue because I'm protected?
Yeah, so you are protected, so you do not have to stay in quarantine.
And that's one of the big advantages to getting vaccinated, is that if you have a potential exposure, the chances of you getting sick and passing COVID on is much, much reduced. So not only for protecting the community, but you protect yourself, and you allow yourself to participate in other activities that otherwise you would have had to have gone into quarantine. And that's affected a lot of us to not be able to go to work, not to be able to do our regular activities. So vaccination really helps and will help us get back to more normal situations. So how about issues around getting a vaccine? Dr. Van Dyne, has there been any vaccine dosage thrown out because people didn't show up for their appointment or they missed the appointment? If so, how many of those doses were thrown out, or what we call wasted?
So as far as that, we do encourage everyone, if you schedule an appointment, please come in and show up. As far as our vaccines that have been thrown out or wasted, those are very low, about less than 1%. We do everything that we can to administer as many doses as possible. So we go around to as many areas to vaccinate and to use all the doses. Our pharmacy and our nursing team have worked extremely hard on competencies to ensure that we get every single dose of vaccination out there. So the numbers of vaccine dosages that are wasted or thrown out are incredibly low, especially when we compare that to other vaccines that we administer. So this is a much lower wastage dose than other vaccines administered. Dr. Villar, anything to add on that one?
Yeah, I think that the person asking the question was concerned that people might not be showing up, and then we waste a really precious commodity. And this is a precious commodity. There were no vaccines a year ago, and we know that thousands of people have lost their lives. So we treat this as a very, very precious commodity. We don't want to waste any. As you said, Dr. Van Dyne, less than 1% of our vaccines have gone to waste. So we're very careful. We have callback numbers. We have standby numbers. We vaccinate some of the employees who are waiting. Sometimes we can pull somebody for their second dose that wasn't appointed that day but was ready for getting their second dose. So we try every way possible to not waste doses, and we've been very successful with this very precious commodity. I'll transition to the next question. I'll read it and just answer it, then ask you, Dr. Van Dyne. So the question is, if we need to get another set of shots, will the nation have them available? So again, we did not have any COVID-19 vaccinations a year ago. They came out, they were authorized in December, and we've been administering and distributing them as fast as we can and pretty successfully. If we need new boosters, if they need to be reformulated specifically to these new variants, will we have them? Well, the way that they're distributed right now is that the CDC has distributed them to health jurisdictions, so states and county health departments, tribal health jurisdictions based on population. So we expect if we have to have new booster doses or new vaccines, the same system would be in place so that we would get vaccinations. And we've been very fortunate to be able to vaccinate pretty much everyone who wants a vaccine so far. So we would expect the same thing for the future. Dr. Van Dyne, we know that when we started this, we were pretty strict about eligibility requirements. So what are the eligibility requirements to obtain a vaccine, and how has that changed?
So the eligibility requirements have changed dramatically over time. So if anyone listening has heard some of the earlier talks, we talk about how there was phase 1A, phase 1B, and phase 1C. And initially we were vaccinating healthcare workers, we were vaccinating medicine men and women, and then we transitioned. And now we've gone to the point where we're vaccinating anyone who's 18 years and older. So it's 18 years and older in the Tampa Nation because we're using a vaccine called the Moderna vaccine. That's for 18 years and older. And then the other vaccine is called the Pfizer vaccine. And the Pfizer vaccine is available for 16 years and older. And that one is currently available at the state pause. And I think that's a good lead-in into our next question. But I'll say first, at the Tampa Nation Healthcare, we are vaccinating anyone who's 18 years and older. So that includes all tribal members. It includes anyone who works in the Tampa Nation. That includes household members of Tampa Nation members, and it includes anyone who's a resident of the Tampa Nation. So if that's the case, we just ask that you bring in your ID. Tribal ID is preferred. If you work in the Tampa Nation, to bring in your employee ID or your proof of residence if you're a household member. But again, anyone 18 years and older can be vaccinated at TONHC. So that leads into the next question, because I did mention the 16-year and older. And so Dr. Villar, here's the question. Now that the vaccine has opened for 16-year-olds, why is Santa Vera Health Center not allowing 16-year-olds to get the vaccine? A parent was told that she had to look for a state hospital, but did not give the parents a website or resource to follow up with.
So as Dr. Van Dyne mentioned, these vaccines are authorized for certain groups. When they did the studies initially, they did it only in adults. biologically, these vaccines should work in younger children, and they should also be safe for the reasons I mentioned earlier. They don't alter your DNA. They've been shown to be very safe, and the biology of these vaccines should be safe for younger children. Right now, they are studying them in children as young as 6 months old. So both Moderna and Pfizer are looking at how well the young children respond. And as you know, flu vaccine is given to babies 6 months and older, and we expect that the COVID vaccine could be given to young children as well. The majority of the severe cases of COVID-19 have been in older adults with higher rates of death, but we know that young people, young adults are the biggest spreaders of it. We spread it to young children, and young children actually can get very severe disease. So I'm a pediatrician, Dr. Van Dyne is a pediatrician, so we're very eager to be able to protect our patients, babies, so that they aren't that unlucky child that gets severe COVID-19, is in the intensive care unit, or potentially could die. Right, we follow the guidelines. The current vaccine, Moderna, is only authorized to ages 18 and up. That will probably soon change. The Pfizer vaccine is authorized 16 years and up. We don't have it here on the nation at this time, and so we can provide that information. And I apologize if the person was not given that information about how to register their teen at one of the state pods in Tucson or Phoenix. But that's something that we can help with, and we encourage, if possible, for people to get that vaccination until the other vaccines are made more widely available to younger people. So, Dr. Van Dyne, this is a tough question because a lot of kids have had to stay home this year. When will students get vaccinated so they may return to the classroom? Has research been done to make sure the vaccines are safe for children?
Clinical studies are ongoing for kids right now. So as you mentioned before, it's going down to ages 6 months. So those clinical trials are underway. And so we hope that those vaccines will be available soon. And the process for that is the clinical trial happens, and then there's approval through the CDC and the FDA. I will say also, when we talk about kids going back to school, there's been a lot of work done here locally by the school system. I know Dr. Villar has been involved as well in ensuring that there is guidance in place so that when the kids go back to school, they're in a safe environment. And that takes into consideration spacing, how far the students are apart, universal masking, so wearing the masks. And also the other things that we look at is the community spread. So how many cases are there in the area? And so all those things are taken into consideration when going into the decision of when schools open. So the next question is, if you do not have a medical chart with the Sanavir Health Center, what documents are needed to be able to register? Once registered, will they be able to get vaccinated there?
So Dr. Van Dyne mentioned earlier that we will now vaccinate all tribal members. So if you're a member of the Tohono Nation or a member of another federally recognized tribe, you're eligible for vaccination through us. Also, household members of those people, so if they're non-tribal members but live in a household, we'll also vaccinate. And also anyone who works on or with the nation, we can vaccinate. And the reason I say we can vaccinate is that vaccine is still in short supply nationwide. There's much, much more available, but the way it's distributed is based on population. So our health jurisdiction on the nation includes those groups that I mentioned. And if you are a resident of Pima County, they get an allocation or a batch of vaccinations for Pima County residents that are off the nation. And depending on where you live, that's the location that vaccine supply will be given. So at this time, we are giving to these groups. And as in the future, most likely, just like flu vaccine, it will be available everywhere. So it'll be very easy to get regardless of where you live or move to. So when you come to get a vaccine, we ask that you bring some identification, because we have to track every vaccine dose to make sure that if there's any issue with it, or if there was a recall or anything, that we can get a hold of people, and also to prove for yourself that you got vaccinated. We ask that you bring a tribal ID, a work ID, or some kind of information that way. If you don't have it, we can often look you up in the medical record. And if you're not a patient with us, but you work for the tribe, we can create a medical record for you. And that way we can vaccinate you here. People also have a lot of questions, which I'll transition into this next question. If a non-tribal household member does not have medical insurance, can they pay for a vaccination at San Javier Health Center, Dr. Van Dyne?
So as far as this question goes, if a non-tribal household member would like to get their vaccine at any of our sites, we would love to have them come in. We do ask for non-native household members to bring a proof of residence. As far as the second part, can they pay for the vaccine? We don't ask for payment for the vaccine. So we would love them to come in and get vaccinated, but we would not ask them to pay for it. The next question falls into this as well. Are the vaccines free? Are the vaccines free, and who pays for them?
So the vaccines right now are paid all by the federal government. No one pays for vaccination. At some locations, they might ask for your insurance information, because they can actually bill insurance companies for someone giving the vaccine, but the person getting the vaccine does not have to pay anything. So that's a great thing, that the vaccine was made free to all individuals across the United States. That was an easy one to answer. Dr. Van Dyne, our next question is, when will students get vaccinated so they may return to the classroom? And has research been done to make sure the vaccine is safe for children? So we had a similar question earlier, maybe just restating that.
So for this question, clinical trials are ongoing for children 6 months old and older. So we do anticipate those trial results, and we do anticipate once those have been reviewed by the FDA and CDC, that the vaccine will be expanded to children. But that hasn't happened yet, but we hope that happens in the near future. So the next question is, elders are the most vulnerable during this time. For those that use the San Javier Health Center for regular healthcare matters and are unable to get an appointment for non-emergency healthcare, where else can they be seen by a doctor?
So for all of us, getting healthcare over the last year has been a real challenge. A lot of clinics closed down, a lot of fear was involved, and people were worried if I went to a healthcare clinic, I could get COVID. Right now, I would say health centers are some of the safest places you can go, because we've learned a lot. We know how to protect the staff, and we know how to protect people when they come in. Right now, at all of our TONHC Nation healthcare centers, we can provide care, and little by little have really been opening up most of our care streams, so people can get care in podiatry, their primary care provider, optometry, and the other care specialties that we provide. And very happily, next month I'll be starting to see kids again in pediatrics. So we encourage people to make appointments, call right now, because we can make them. And we also have started telemedicine, so we can provide phone or virtual doctor visits, which is the next question. But we encourage people to make appointments now that COVID is less common and we have the clinics open. It's time to try to do that so we can all catch up on our routine healthcare to stay healthy. Dr. Van Dyne, do you have any closing statements?
Yeah, I would just say thank you for the opportunity to share information about the COVID-19 vaccine. I would encourage everyone to talk to your family about it. If you have questions or concerns, please talk to your healthcare provider about it. I'd also say everyone is important and worth protecting at all costs. So please protect your physical and mental health. We're continuing to wear masks, so show your support for the frontline employees by wearing your mask. And if you need anything, please reach out to us. And thank you again for allowing us to participate in the webinar.
I'll also thank the listening audience and also make a reminder that in getting vaccinated for COVID-19, we're protecting future generations. The Autumn Apadag and Himtag are very important, and every single elder that passes away carries some of that with them and is unable to transmit it to the younger generation. So please continue to protect each other, and I thank you again very much. Have a great day.